around before our program starts. Amber, would you start, please?
All right. Good morning, everyone. I am Amber Freeman. I am the Interim Director of Training, Technical Assistance, and Community Impact at the Connecticut Coalition in Homelessness.
Ryan?
Hello, I am Ryan Beach. I am the Interim Director of Development and Communications with the Connecticut Coalition to End Homelessness.
Jennifer?
Good morning. My name is Jen Paradis. I'm the Executive Director of the Bethel Center in Milford, and I am a board member of the coalition.
Thank you. Charlie?
Good morning, Charlie Tracy, Chairman, Economic Planning and Development Commission in Pomfret. That and 250 will get you a cup of coffee. Thank you.
Thanks, Charlie. Krishna?
Krishna Winston, Middletown. I'm steering our recertification under Sustainable CT, and I chair the Recycling Commission in Middletown.
Thank you. Catherine?
Hi, Catherine Whitney, Community Impact Program Manager at CCEH.
Maddie?
I'm working on the Goshen, Connecticut Sustainable Team, and we just got our bronze, so we're moving ahead.
Terrific. Well, welcome. Amalia? Oh, Amalia's screen is green, so I'm going to move to Jessica.
Hi, everybody. I'm Jessica Kubicki. I am the Chief Initiative Officer with the Housing Collective. We are the backbone for the homeless response system of Fairfield County and the Northwest CAN, which is the Waterbury Litchfield area. Thanks for having me.
Great. Thank you. Leslie?
Hi, everyone. I'm Leslie Berwin. I'm the Program Manager at Greater Waterbury Health Partnership.
Thank you. Lindsay?
Hi, I'm Lindsay Larson. I'm a project manager with Litchfield County Center for Housing Opportunity and Initiative of the Housing Collective.
Hi, Lindsay.
I work mostly on the affordable housing side, so I'm always looking to learn a bit more about homelessness response, because that's obviously a huge part of what the Housing Collective does.
Great. Lauren?
Oh, sorry. The lighting in here is a little funny. Hi, I'm Lauren Coakley Vincent from Bridgeport Downtown Special Services District, and the Housing Collective. One of their spaces is in our neighborhood, and we're a community-based organization that works primarily with businesses, but we do frequently engage with individuals in need of housing or other social service support offerings. So I'm excited to hear more about what's going on. And I know the great work that Jessica and the rest of the Housing Collective are up to. So looking forward to it. Thanks.
Great. Thank you. David?
Hi, can you hear me, Mary?
We can hear you.
Hi, good morning, everyone. My name is David Oakes. I'm the Public Works Facilities Manager for the City of Bristol and their lead contact for Sustainable CT certification. So I'm here to learn a whole lot that I don't know about homelessness. And I know Ryan Beach has helped me via email last go around. And I work with Amalia, who I saw and now is gone. That's probably thanks to our lovely Wi-Fi service in the town of East Haddam. I'm also on that sustainability team as well, because I just can't get enough of all sustainable CT, all things sustainable CT. So I'm going to shut up and sit back and absorb as much as I can from all you smarter folks today. Thanks.
Well, thank you. Ed?
Hi, good morning. Ed Ciccarello from the Sustainable Rocky Hill Task Force.
Great. And Leslie?
I think I already introduced myself.
Oh, you did. You moved into my grid. Thank you.
Mm-hmm.
So I just want to welcome you all. We have an action category 12, that I hope that all of our town members are familiar with. And it's simple steps. It's designating a member of your town staff to be the liaison for homelessness services, training that person, collaborating with your coordinated access network. And hopefully today you'll become a little more familiar with the terms we use, like a CAN. It sounds like, what are they talking about? It's your coordinated access network. It's the people that you're meeting here today who do the work and help you to support those in your town that are experiencing homelessness or at risk for homelessness. One of our actions calls for passing a municipal resolution and increasing public awareness, developing and posting information on your town's websites, organizing communication, coordinating community conversations to talk about the issues of homelessness and make sure that people have the support they need within the community. And then committing funding and ensuring that people that are experiencing homelessness have somewhere to go 24 hours a day. I cannot imagine, because I haven't faced that situation, how scary it must be to have nowhere to be. And so we as communities can work towards that by completing this action framework. And I want to introduce, to start off, the Connecticut Coalition to End Homelessness staff that are here today, Amber and Ryan. They're going to take over. They have some slides and a great presentation, but I want you to feel comfortable when you have a question to ask that question. They are fabulous people. I can tell you from working with them, there is no question that you can't ask. And there's probably no question that they can't answer. So this is a question and answer opportunity to learn. So feel free. You can raise your hand or raise your hand on the screen, and I will try and keep up with what's happening on the screen while Amber goes through her slides. And if there's questions, we will stop and ask and answer those. So I'm going to turn it over to Amber, and thank you very much for being here today.
All right, thank you so much, Mary. So we're just going to go over just a few slides. Of course, we're going to talk about what our action steps are for sustainable CT, but I always think we should start with some just basic education. As we started to do this work, we've heard of so many towns not really understanding what homelessness is, or saying that they don't have homelessness in their town or their municipality. So we're going to go over some fundamentals of what homelessness is, what does our system look like, what type of services we offer, provide some data, and then really go into our action steps. So actually, I'm going to hand it over to Ryan to start us off.
Great, thank you. Yes, thanks, Amber. I'm going to give just a quick little history here. The Connecticut Congress of Municipalities approached us a few years ago now. Looking, they'd heard this sort of bubbling up through their membership around addressing homelessness, and we sort of set off on this project, which has ended up with a lot of feedback from towns, from our providers, from our expertise to put together these action steps. And they've, really been crafted with a lot of careful thought about how municipalities can not just take actions, but really partner with the homeless response system. And that's really what our action steps are about pretty much across the board. Is we don't want to create duplicative work. We don't want people to feel like they have to do this on their own. We don't want municipalities to feel like, oh, I have to end homelessness in my town. No, the work's being done. It's a support system. We have an amazing coalition here across this state that is doing this work every day. So it's about working together with the work that's already being done to make a greater impact. And there are a lot of areas. The federal response is actually looking a lot now at how municipalities can really be a part of that effort. So everything that we try to put together and everything we'll talk about today is about that partnership and not feeling like you have to kind of carry it on your own. So we'll go a little bit over the data here. We'll start with, this is very true. This is from our data. Connecticut CCH manages the statewide homeless management information system, which is one of the primary data sources for identifying who's using homeless services. We also have a couple of other sources, including the by name list. You'll hear that phrase by name list, or BNL. That's just a little bit of jargon that's important to know. So these two different data sets kind of represent different things. And that's how we sort of look at some of these numbers. So if you hear those things, feel free to ask any time if it's not clear where data is coming from. But most of this information is HMIS. These are people that are in services, that received some sort of formal service over the years, but then we also look at who's calling the system. So this big number on the left here, the 7,832, that's basically who was served by emergency shelters, transitional housing, or street outreach in 2022. These are the people that were identified, came through that program, hopefully exited to permanent housing or some other type of more stable housing but that's who came through the system. When we talk about the year-over-year number, that's kind of the number we look at. The number below it, I think, is a really important one, especially for municipalities, that almost 2,000 people utilized our cold weather services. And that's exactly what it sounds like. It's emergency shelter or space that opens when the governor activates cold weather protocol. These are crucial services, literal life-saving services, and may not necessarily be a formal shelter, but these are for anyone and everyone that does not have a place on a night when the cold or the wind or the weather is so dangerous. And municipalities are a really key part of that infrastructure every year. The breakdown there is just kind of who our system looks like. About 2,100 families. In those families, that represents about 1,200 children. And then about 57 or so 100 individuals. That kind of makes up that 78-32 number. So it's just a little idea of kind of what we're talking about when we talk about the total population. Next slide, Amber.
Ryan, I'm going to jump in here. We have a question from one of our
thank you.
member towns. And so the member town was provided with homelessness data from their liaison in the community services, but it was not specific to the town, but the CAN region. Is there a resource for municipal specific information?
Great question. And I can say that the answer to that question is we're working on it. That's actually something that we continue to hear. That is a part of the work that our data team is thinking about, is how do we get granular like that? Because towns do want that information. And actually, I think we are at a point where we do want to be able to look, we want to be able to look at the system community up to the state and back down. And that's how we're going to drive. So that is actually in the works now. That's that comes with, I said, I think that earlier, that by name list. There are some modifications there that will help get that data. There are some HMIS modifications that could help get that data, but that is actually something that we're working on. That's part of this the data action under our category, is that as towns are helping us be partners in that, we can get better at giving that specific data. So this is an unfortunate slide because it hasn't been like this in a little while. But you know, we unfortunately, usually these arrows point down or stay relatively steady, or the numbers next to them are not quite as big. But to be expected, we're still feeling the effects of the pandemic, and you know, our system really went into overdrive and has been sort of operating way over capacity, and always has been operating over capacity, and is, you know, consistently underfunded. And then the past couple of years have just really exacerbated that. And we've seen a lot of that. And, you know, again, unsurprisingly, that coupled with economic factors, we are starting to see some somewhat significant rises in our numbers. Is 39%. From 2020 to 2022, and this is that by name list I was discussing. We've seen that list grow pretty significantly. You also may see numbers thrown around that are the point in time count. That's a little bit of a different data source. That shows a year-over-year one night snapshot. So if you see those numbers look a little different, that's the difference between them. We have a much more comprehensive data set, and can sort of look at things a little bit differently. But just if you see those numbers back to back, and people are, if there's any confusion about that, you know, of course, we're always able to answer those questions. I think the biggest and maybe one of the most stark ones here is just the need that's coming in. 56% increase in calls to 211. So as hopefully many of you know, 211 is the single point of entry for people seeking housing services. People call 211. That's the way that they're, you know, they're able to access any of those services. And of course, unfortunately, we're seeing, you know, a huge increase in people just calling for these services to begin with. Thankfully, not all of those are resolved or ended up, you know, in literal homelessness. But that's it shows the extra burden that continues to grow on the system that does this work. 30% increase in unsheltered households. We're definitely seeing that rise in unsheltered homelessness, which is another, you know, concerning touch point. And again, an area where I think a lot of municipalities have concerns and want to address that or figure out ways to address that. And then that 82%. So once someone calls 211, they're given what's called a coordinated access network appointment. And we've seen an 82% increase in those appointments in the past year. So hopefully those appointments are ending in diversion, which means they don't fall into homelessness or, is addressed some other way. But we're obviously, our system is just multiples, just really, really seeing more and more and more and more people come in. So it's really important that we're all working together to build a system where we're moving people into housing, keeping them housed where possible, and finding solutions that are not falling into shelter or unsheltered homelessness. I saw a question pop up about if 211 contacts the point person in the town. I don't know the specifics of that. There may be another colleague on the call that might be able to answer that a little better. I don't know that that's what's always going to happen. Sorry.
Nope, they do not contact the town. I think where you would get town specific stuff would be coming from us in the Can area. And so Charlie in particular, or actually to anybody, if you are in Fairfield or Northwest, certainly I want to make sure I have your contact info. We can certainly flag that kind of stuff. And I would probably be speaking for my counterparts in the other area, but they would be doing the same thing. So we could let you know if there is somebody in specific towns that you all are a part of. Sorry, Ryan.
No. That's exactly who I was hoping would answer that question. Sorry, Charlie, if you can just confirm the what's the turnaround on 211? Sorry, I just don't understand your question, but I will if you just rephrase that a little bit. And then Krishna, children in this particular stat it's 18 and under. It's 18 and under in a family. So it's 18 and under in a household. That number does not include unaccompanied minors, who are a historically undercounted population. We don't necessarily publicly state those numbers because we're still kind of, we want to make sure we get those numbers right. But in this particular stat, that is children under the age of 18 in a family, which means there is another, they're not the primary household adult. Okay, yeah, next slide, Amber. So very quickly, I just want to go over this quickly because it's so prescient and it's happening right now, and we do need the support. So, a lot of this leads to better support for our CAN systems. We have a very high, not high, honestly, not a big legislative ask, an enormously impactful legislative ask for what in the grand scheme is not a ton of money. So I just want to address, those numbers and the impact that is having on our system right now. We are seeing, organizations having an immense amount of trouble retaining staff, paying staff correct wages, and just kind of maintaining these literal life-saving services. I tossed this slide in here mostly for review upon sharing, but we do have an ask of the legislature right now. There is a raised bill which represents the homeless response system and rescuing the homeless response system. Any municipality that wants to join this effort, this is not directly a part of sustainable CT actions, but this is certainly those are important voices, obviously, in the legislature. So I just wanted to highlight that and just kind of give some specifics of what our ask is. But basically what this goes to is to make sure that the people doing this work are paid adequately for the work they do, compensated fairly. And then also just ensuring that our coordinated access networks, who really are the backbone agencies, have the funds they need, annualizing this cold weather money. Next year, the cold weather money runs out. So we don't have funding for those shelters and that emergency. And then also investing some flexible funding and being able to pay that security deposit, pay that first month's rent can really be the thing that keeps someone in an apartment versus 3, 4, 5, 6 months of shelter and then eventually getting back to permanent housing. And that's such a trauma. So, again, obviously open for more questions. Don't want to spend too much time on this, but did just want to flag that this is a very active ask. We're getting a lot of traction around it right now. And of course are seeking any support for people that really want to, play a part in this. Charlie, I saw your question. Let me see. So we actually, we have some stats on this. Most cans are still in the 24. So they will get, if they call 211 and they're eligible for resources, they will get a coordinated access network appointment within 24 hours. For the most, I think that number is still hovering around 1 for almost everyone. Sometimes it can be that day. And it's really once they get to that stage, and we will have a little diagram of how the 211 and the homeless response system works, and the CAN system, that's when they start to get the more in-depth case management, housing resources. That's when they're working with someone to identify, you know, all of the potential you know, opportunities and everything that they get to services. But yeah, the once someone gets through 211 and gets to the CAN, it happens quickly. That's the goal, because you know, it really matters. You need to get them there quickly, and that's, you know, resolving things fast is a big part of a successful homeless response system, because the more time people spend in that crisis state, the harder it can be to potentially get out of it. And I think that's sort of it for me. Again, any questions about the data or some of that thing? Amber is going to go into a little bit more of the specifics of what homelessness is specifically, and then the way the system works, so that might answer some of those questions you might have. But thank you all for your time, and you know, for your interest in partnering with us on this project and doing this work, and through Sustainable CT, who is also an amazing agency and amazing partner.
Thank you, Ryan, very much. Amber, I'm going to turn it over to you now.
All right. So when we're talking about homelessness, what are we truly talking about? There's two main types of homelessness. There's literal homelessness, and that refers to people that they're literally homeless. They're actually sleeping outside or in some other place that's not meant for human habitation. And then there's imminent homelessness, and that refers to someone that is at risk of losing their housing within a short period of time. Maybe they're facing eviction, or they were temporarily staying with family or friends, and they will not have anywhere to go. So they're at risk of becoming homeless. So we have four main categories, and I'm just going to quickly go over this. So category one is literally homeless, and as I said, it's for those people that they lack a fixed, regular, and adequate nighttime residence, right? The primary residence is a place that's not meant for human habitation, or maybe they are living in a shelter or some type of transitional housing, or they are being hoteled by an organization. They're not paying for it themselves, or they are exiting an institution where they stayed for 90 days or more. 90 days or less, I'm sorry. And they resided in a shelter or a place that's not meant for human habitation before they were in that institution. So we also have category 4, which I think this go around with Sustainable CT. We kind of updated our action steps to include this category, because people don't realize that this is a category of homelessness. And that includes those that are fleeing or attempting to flee domestic violence. So it's any individual or family who is fleeing or attempting domestic violence. They have no other residence to go, and they lack the necessary resources or support system to obtain other permanent housing, right? They need assistance. So they are category 4. We have category 2, which is imminent risk of homelessness. I went over this briefly, but the range for this kind of varies between 5 days to 14 days. But as I said, those are those people that are at risk. This is the group that we really, really want to provide some great assistance to, because they're not experiencing homelessness yet, and hopefully we can divert them from actually coming into our system. So imminent risk, that is where the prevention comes in, that is where the diversion comes in, all the resources so that we can assist these people so that they do not actually come into our system. And when I talk about our system, we're going to go over that in more detail. Our last category is category 3, and that's homeless under other federal statutes. So those are for the unaccompanied youth under 25. It's kind of those areas where they may not fit another category, but we don't really have too much category 3, but it is a category of homelessness. So causes of homelessness, there's many, many, many causes of homelessness. And unfortunately, as we said at the beginning, homelessness takes place in every single town, every single city. Sometimes it is people, especially with this day and age and with the housing crisis that we're going through now, someone may be experiencing homelessness or a housing crisis, and it may be someone you know, and you're not even aware. But there's many causes. It's lack of housing. So without housing options, people face eviction, instability, and homelessness. Right now, there's a shortage of housing, available housing, and then the rental prices are going up. So it's really, really, really hard to for someone to sustain their housing as well as find new housing. Income and housing affordability, we're seeing so many of that right now. Unfortunately, individuals that have a history of health problems are likely to fall into homelessness because mental health, substance abuse, physical health, having to pay for those type of medical assistance, or just having a illness that's so severe that they're not able to take care of it and sustain their housing, they will at times experience a homelessness. And then, as I said, we have those that are escaping domestic violence. And then also we have the impact of racial disparities. So there's no way that I can talk about homelessness without talking about the racial disparities that take place within our homeless response system, or just homelessness in general. So minority groups in the US experience homelessness at a higher rate than whites. And we're gonna go over that. So here's a graph for you all, and you can see that the US population consists of 13% Black, right? However, those that are within our homeless response system, or the homeless population, is 39% or more are people of color. And more than 50% of the families with children are experiencing homelessness. So that's almost double in the number. And it's kind of like that graph should be reversed, but it's not. So minority groups experience homelessness at a higher rate. I just want to open it up for you all as far as, why do you all think that that takes place? Why is that?
Well, I'll just jump in, Amber, and housing is a transaction. It's a financial transaction. It's a legal lease or a legal purchase agreement, and it requires the financial ability to engage in that contract. So if the employment opportunities are not there, then the opportunity for having secure housing isn't there. I know that for minority populations, healthcare is less accessible. And so we've looked at the statistics that people that have medical concerns tend to be less housed. So I think it all feeds into the data that we know and we are aware of, all feeds up to this housing crisis among people of color.
Good points. Good points. Yeah, that, the healthcare, employment, also just a longstanding historical and structural racism, poverty, incarceration, affordable housing, housing discrimination, and, as you said, access to quality healthcare. So those are some of the many things that affect people of color. And as you all are going through the action steps, we did include a good amount of equity pieces in our action steps. So just over the years, there's been so many different solutions or strategies, I should say, to end homelessness. And it's not just one thing that works. There's so many different strategies, and we try all of them because you never know what can actually work for someone. So obviously we have emergency shelters, soup kitchens, drop-in centers. There's homeless outreach, which are teams of individuals who identify and engage people who are unsheltered. There's supportive housing. So they are providing a housing subsidy, and then they're also providing wraparound case management services. Rapid rehousing is one that we truly encourage, because you never know if someone just needs that temporary short-term assistance so that they can bounce back on their feet. But that includes housing search, navigation, case management, and this short-term assistance. Then we have people that may just need a little bit of assistance. So of course, we have rental assistance and affordable housing. There's medical respite, and then there's reentry services, and that's programs to help people transition from prisons and jails back to the community. So there's a lot of different solutions to end homelessness.
Amber?
Yes.
I'm working with Teague up in Northeast Connecticut, and there was an unhoused person who actually spent 3 years living in the woods behind a shopping center. And the NBC local news did a special on him. And one of the reasons he couldn't get housing is he had no identification. He had been incarcerated and was taken from wherever he was in jail, brought to a courthouse in another area, and they let him go. But his ID was down at the place of incarceration. And they said, well, you got a month to get it back. Well, he had no way of getting in touch with the people at the jail. So it became a catch-22. And it took a couple of years for this guy to get new identification. And in the legal system, it's like, well, all your personal belongings stay at your point of incarceration. And if you get freed, you're freed from the courthouse at which you're, being held or being tried. And there's a disconnect. So, at one level, it seems pretty easy. Well, you call the jail and you get your stuff back. Well, if you're unhoused and you've got no identification, you've got no money, you've got no way to get in touch with that the jail, then there's a disconnect there that there's no legal reason for, but there's an effort to try to get the people's belongings to follow them to the court, or at least enough to get them out in case they're freed. Does that make sense?
No, that makes complete sense. And I would say right now, we're actually working with Department of Correction and CSSB on that, as far as an individual having identification when they're released, or if they had one, having it go to their next place, or starting that process while they're still incarcerated so that they can get a new ID and have that ready upon release. There's definitely a disconnect, and that is something that we are truly working on. We also have partnerships with DMV, as far as if an individual is in an emergency shelter, they can get a free identification. So we are trying to tighten up that disconnect so that people can have the identification and those other tools that they need in order to get housed.
Thank you.
Thank you. So our current system that we have right now is, we believe in a systems approach. And we have a few underlying principles as far as the approach that we're currently using to end homelessness. So we believe that everyone is houseable. So research has shown that with the right level of support, everyone can achieve housing stability and be a successful tenant, regardless of their service needs, such as mental illness or addiction. Really, it's a housing first approach. So housing is a basic necessity. So someone needs that basic necessity, that foundational requirement in order to focus on other things. So let's house someone first, and then we can focus on everything else, their mental health, getting employment, all of those other things. But housing is a basic necessity. In our approach, we believe that intervention should be tailored. This is not a one size fits all, right? Some people may need very extensive service, and then some may need just very light touch. So it's tailored based off of a person's needs. And then lastly, our system is, we have a systems level approach. So we believe that in order to end homelessness, it should be rare, brief, and non-recurring. So of course, we don't want anyone to experience a homelessness. If they do, it should be as short as possible and only happen one time. So different states, communities, all work together, such as our providers, such as other community resources, such as municipalities. If we all work together and have a more tailored system approach, we can get to a point of ending homelessness at a faster rate. So CAN, right? You all heard us say CAN so many times, or Coordinated Access Network, but what is that? So our system works off of CANs, and this started in 2014. That's called Coordinated Access Network. There are 7, and you can see from this, it's broken down in different colors by region. So each town falls into a certain CAN, right? That is your go-to. These are your people that are providing the services within your region. So within the CAN, you have emergency shelters, we have housing providers, outreach, and then within each CAN, they're working to coordinate to divert households from shelter. They're managing their access to shelter. They're conducting the homeless outreach. They're matching individuals to housing program vacancies and providing a whole bunch of other services. So I'm going to quickly go over, and anyone feel free to interrupt me. So these are just some services available throughout the CAN, right? Of course, we have the emergency shelter, and that's reserved for when deemed a last resort. As I said, we want to divert everyone as possible. But we do have emergency shelters, and during the time of COVID, because there were so many individuals that needed to be sheltered still, but we were operating at a lower capacity, shelters were actually hoteling during that time. As Ryan touched on earlier, if someone comes through the CAN and they need some type of assistance, CAN can provide referrals to other community partners. So these referrals can be for mental health, for substance abuse, medical, employment, legal, food pantries, clothing. It's whatever someone is looking for, they can provide some type of referral. Case management, as I said, it based off of a person's need. It can be light touch or it can be intensive case management. It's all about what someone needs. And then if someone's actually matched to a housing subsidy, they can receive assistance with landlord engagement to find a landlord that will be a good match. Also advocating for the individual to be housed, providing education on what that being a good tenant looks like, or how to understand their lease and be compliant with their lease. And then lastly, financial assistance. It can be one-time diversion assistance to divert someone from entering our system. And then we also have wrap-free housing, which is short-term rental assistance, and then permanent supportive housing, which is long-term rental assistance. I'm just going to say I'm going over this information quickly so that we can allow time for discussion. However, in the action steps, we do emphasize training. So in our trainings, we'll go over all of these information in more detail. So our homeless response system, and what does that look like? Ryan touched on it earlier. So really there's two ways to enter our homeless response system. And actually we might need to have an updated diagram because now we have the hubs, but there's two main ways to enter our system. So an individual that is in need of assistance can call 211. And as you see throughout the system, at every part, you see arrows going up for diverted, because we truly try to divert someone at every single part throughout our system. So someone can call 211. At that point, they can be connected to the CAN and they'll have a CAN assessment. At that point, they are trying to divert them. If they're not able to, they are either prioritized for a shelter, or maybe they're added to a wait list, or if there is vacancy, then they're actually entered into the shelter, right? And again, we're trying to divert. Once someone is in the system, they're entered on a by name list. And the by name list is our one statewide list that has all of the individuals there that are experiencing homelessness. So they're on a by name list. When someone's entered on a by name list, they're then, after some time, they are discussed in our housing solutions meetings in each CAN, where each person is brought up and see if there's any type of housing opportunity for them. So that's our main way. But however, we do have people that don't come through the system through 211, and they come through outreach. For those are those unsheltered folks, kind of like the person that you were talking about. So they're unsheltered, and our outreach team can bring them into our system without them necessarily calling 211. Okay. So I just said, like, do we have any questions in the chat?
Just a quick note. When I first started going down this path through sustainable CT and looking at the homeless situation, it was a small thing but I got the town of Pomfret to put 211 on the homepage of the website for the town. I had researched, and there's not many towns that you got to go digging to look for 211, and we have it on the page now.
Great. So you all probably already have some points because that's one of the action steps.
Well, we hope we do things for the right reason, and if there's points, God bless America.
So Amber, there's a couple of questions and they both relate to the CAN services. So one is CAN staffing, if you can talk to who staffs the CAN. And then the other is, where would someone go if a bed is not available? So if somebody calls and they're in urgent need, where would they go if there is not a placement available?
I think I'm going to let one of our CAN providers answer.
Okay, great.
I can, and then I'll defer to like Jen, because I know each community kind of does things a bit differently. So in each of the CANs, they are staffed, I would say, somewhat differently. So for example, in Fairfield County, we have, just for the sheer volume of inflow, we have about 12 staff that handle inflow. Whereas in the Northwest, which is significantly smaller, and gets about the same inflow as Bridgeport in Fairfield County, has 4 staff. So it kind of depends on the inflow. And that's just those that are considered kind of our like diversion specialists / navigators, which are those that take in that inflow. That's not including obviously the additional steps. So when you're looking at this chart, you're looking at kind of that second yellow box. That's the staff I'm kind of referring to as those that handle that piece and kind of help clients kind of navigate whether they're then, self-resolving, finding their own apartments or going into shelter if that's necessary. To answer the second question, the bad news is that the state of Connecticut is not a right to shelter state. And so as a result, if we are full, there are times that is the response, unfortunately. We certainly try to accommodate as much as possible. And I will say responses can and are different during cold weather, which is normally somewhere around December 1st to like the end of March, give or take some time frame and where you are in the state. The challenge is, even with additional overflow through cold weather, there are still capacity issues, which is why we are always working hard on trying to divert people from our system, which meaning if we can find appropriate and safe locations for them to go and not have to enter into the homeless response system, that's ideal. And then we also work really hard on that other side of housing. So then it inevitably frees up our shelter space for those that are most in need. I will personally say, at least in our communities, I don't want to speak for anywhere else, we do not meet our need. We are always in need of more space because unfortunately we do have times where we have a wait list to access shelter. I don't know, Jen, I don't want to speak obviously for New Haven, and I don't know if there's anybody else here.
Yeah, no, I mean, I think that the points that you brought up are very much kind of what it looks like in the New Haven area as well. And I apologize, I moved myself and I'm joined by one of our diversionists. So when you think of the yellow box on our screen, this is Cindy, and she provides diversion services from Milford to Guilford. So along the shoreline, kind of absent New Haven, because we work within the Greater New Haven Coordinated Access Network. What I'll say is, I mean, this is probably the most, I think, the most tension and agitation in our system is that someone needs services today. Someone needs access to shelter today, and there is not an open bed. And it's important because actually the one comment that I wrote down of the presentations so far are that, that during cold weather, when we do stand up, like for example, Bethel has a 15-person warming center program, and there are many other warming center programs throughout the state. As Jessica said, those help to alleviate the capacity needs of the system during cold weather. However, those are individuals, and it speaks to the need of what our shelter system needs and our homeless response system capacity needs are year round. So when we talk about like partnerships and being aligned, nonprofits and the homeless response system in your community municipalities need to be really on the same page when we talk about like what is the municipal need for each of our towns and cities, because there is an unmet need. You know, our unmet need is about 9% in the greater Milford area. And that means that folks who are in need of shelter today are waiting on a shelter wait list to have access to that opportunity. And we all know that shelter is not just a basic need, it's a human right. What I'll say is that there's some things that that are built into our system to do two things. Number one, shelter does not cure everything, right? Like it is not an ultimate cure. And so what we really do very well, and part of Stacy's role here is to ensure that folks are not entering into the shelter system who do not need it, you know, it's not the tool, the intervention that would be most appropriate for them. And so that's why diversion is so important. In the New Haven area, we're diverting about 7% of the people that we see. We need to be increasing that number much higher than 7%. Pre-pandemic, we were 45, 50%. Changes there are, I mean, you could name it all on this. We've named it all already on this call when it comes to lack of affordable housing and the barriers to successfully getting into the housing that is currently available. So that's a big piece. There's also a prioritization methodology on our wait list as well. So if you are somebody who is under the age of 25 or over the age of 55 or have a physical disability, mental health disability, there's a number of variables that create high, kind of a scoring, you know, I hate to use that word, but I guess that's what it is, scoring on where somebody falls on the wait list. So what's important to note is that every day, every minute, folks do need to be also working on self resolution options as well. And this system is built to support as many people as possible. And Ryan said at the top of his presentation, we know what it will take in order to fill the gaps in our system. And so we're asking for amplification on that message. But there's also the true need of folks working on self-resolution plans as well when that is possible. The last thing I'll say is, you know, for municipalities, the partnerships with local nonprofits in this work is so critically important. And we have to share the supporting this population year round. So if you are in a community that is able to stand up things like day centers, or we call them homeless hubs, where folks can have access to services and meet their basic needs and get connected to these systems a little bit more. You know, municipalities have a lot more effectiveness in standing up those tools within the city than a nonprofit would. And so we definitely want to take, oh, thank you. We definitely want to take lead, work with you and have municipalities when they can take leads on the things that you'll be more successful at more quickly. And I got off track. I know that that's a space for that's tension, and rightfully so. We need to be working on that.
Thanks, Jen. Because of time, I just want to quickly go to the action steps. You all, hopefully you looked at it on Sustainable CT's website, but to just go over some things and really to piggyback on a lot of what Jessica and Jen said as far as the importance of having a collaboration with the CAN and working within our system. There's a lot of things that we truly need you all's help and assistance with. So quickly to go over the action steps. So 12.1 is about strengthening the workforce capacity to address homelessness. So you all identifying a point person. creating a municipal task force, attending trainings. CCH has tons of trainings, and you all can go right to our website and sign up and register for trainings. Also create a resource sharing forum to share information about homelessness within your town. Action 12.2 is to increase public awareness and support for efforts. So making a town resolution call to action as far as you all are committed to ending homelessness and what that looks like, what you're going to do. We actually have a template that you can use. Having on the website, we talked about that a little bit, resources for those that are experiencing homelessness or housing instability, even if it's just putting 2-on-1 on the website, or how to get in touch with the CAN, or now we have hub information, but putting resources on your websites, organizing community conversations with the people in the community, diverse background of folks, to have a real conversation about homelessness in your community and what needs to be done within your community. 12.3 is collecting the data and sharing homelessness information. So we have data, as we talked about, on a larger scale, but we don't have that in each town data. So if you all can collect data and share it with your CAN and work with a collaboration to get that data, that would be really, really helpful, so we can truly know who's out there. And then 12.4 is provide or mobilize resources to address homelessness. So commit dedicated funding to directly address and prevent homelessness. It can be creating a line item. It can be having an increase of salaries for those that are working with those experiencing housing crisis. But we need dedicated funding to address and prevent homelessness. Crowdfunding for statewide, regional, shelter diversion, rapid exit, those flexible funds, so we can divert people. Identify coordinating funding and resources, and then safe access to services, especially in extreme weather. Sometimes going through cold weather and not knowing where you're going to have cold weather. You need a building. It would be really helpful for the providers to work with the municipalities when identifying those locations. So I quickly went over all of this. We have so much information to go through. We'll have additional trainings and go into everything in more detail, but really just want to open it up to you all.
Okay, and why don't we stop the screen share so we can all see each other? And I do want to comment on action 12.3. We get a lot of questions from our volunteers on their town sustainability teams about that information. If you remember the slide that Amber and Ryan showed, where they showed the breakdown of how people are homeless. Are they homeless as families? Are they children? Are they individuals? That's the kind of data we're looking for, non-identifiable data. So we don't want the names of people who are homeless. We want to know, are they single adults? Are they families with children? So this is not, when you're working with your town social service agencies, you do not want to know the identity of these people. And you can tell them that from the beginning. You're looking for statistical data, not the names and locations of the people who are experiencing homelessness. So it is helpful to the CANs to get those numbers, to know how many families there are, how many children, how many adults, but we are not asking for names, or we are not asking for any kind of identifying information about these people. So I just wanted to clarify that if you're working on action 12.3. So we have a few minutes left. I'm going to open it up for questions. I hope that this has been helpful. I think it's a great way to learn, is to learn together. So if anybody has any questions, feel free to jump in.
I'm finding a real world experience here in working with Teague. We've set up a subcommittee, excuse me, to address homelessness and maybe get some housing first going in Northeast Connecticut. And the individual communities and the Council of Governments in the areas are reluctant to get involved. Whether they feel it's a hot potato or there's so many other irons in the fire that they're having issues addressing it. So we're looking at it from a perspective, do we seek a public, governmental type help? Do we look for private sources? Or there's there's a place that started in Springfield, Kansas called EdenVillageUSA.org. And it was a religious group that got together and they built tiny houses and they have a community, and you can live there for a short time or you can live there for the rest of your life. And it's an intriguing type of thing. They're building one up in excuse me, up in Worcester. And there's one I'm hoping to visit in Wilmington, North Carolina in April. And I'm just wondering if anybody has any experience with this sort of thing and how to get funding for it.
I can speak to that briefly, and just there's a lot of these. This concept of some of these alternative options are really coming up in a lot of places, right? Because we are in this sort of feeling like crisis mode. I think that what I would say to any of this is, you know, there is not any necessarily wrong or right way, but just that this works in partnership with the response system in the area, so that you know, we're just making sure that those are the right resources and dedicating the right resources in the right ways, because we are seeing, again, there's a lot of commercial property transition to housing. You know, we're seeing, you know, some of these different, you know, to kind of alternate plans to create more housing out of existing land, right? Sort of changing zoning to allow that kind of thing to happen. So I think that, you know, again, these are all potentially good solutions. It's just making sure that it's in coordination with the sort of the main effort. But in terms of the specifics, yeah, there's a lot of more and more of this popping up all over the place. So I think those resources are going to become more and more abundant, and you know, as they come up, we can seek to connect that. I don't know if anyone has any other specifics on here about that. Jen.
Okay, thank you.
Yeah, I have a couple of points, unless someone else is wanting to continue answer that.
No. All I was going to share is start where you can. If this is where you're gaining momentum, and Ryan's points were exactly right. But start where you can. If you're seeing people be inspired and want to come to the table to talk about a tiny house community, know that it's not going to be your unicorn. It's not going to be the thing that ends homelessness in that corner of the state. And I love Putnam and I love Pomfret, the best antiquing in the world over there. But so it's not going to be the ultimate solution, but the project setting, the organizing around it, the community building that happens with that, that's going to allow so many other opportunities to come up in your region, and make it safer for people to talk about what they really need, and what type of service gaps there are. That's the only thing I'd add.
Okay, so I have a few things I want to say. First of all, there's a really amazing article about homelessness in the Times Magazine about interviewing 30 people all around the country, which I really suggest people read, because it shows how helpful intervention is in the long term. So the other one is, what are we doing on the statewide to make this our state right to shelter state? Is that part of the legislation? And then the third question I had is, we're going to be having a workshop with the Nature Conservancy about resilience and emergency stuff, which I think could answer on the municipal level the problem of shelters and creating shelters in cold weather, and especially in our area where there are a lot of trees falling down, you know, is the idea of cold shelters. So you know, just the idea that we can kind of jump between climate resilience and because part of the increase, I think, is created by the climate emergency. So those are the three things that I had to ask or point out.
I can speak to a couple of those also, in terms of we're not necessarily, Jen, maybe you know more, others, someone might know more about what we're doing in terms of the right to shelter. But in terms of some of the other points we're addressing, I mean, a lot of that is wrapped in the legislative agenda I mentioned earlier about annualizing that funding, so that there are those resources to do that. Cold weather shelter is not, it needs to be run by professionals. It needs to be staffed properly. It needs to have, adequate resources to run properly. So that's, annualizing that funding is a piece of that. We are working on some right to housing legislation to also make sure that, we are guaranteeing housing as a human right in the state, and that there is action and quote unquote teeth sort of behind that statement as well. I think that answers both of those. Jen, sorry, back to you with your hand up there.
And Jen, we'll be respectful of people's time because it's 11 o'clock. So I'll let Jen answer, kind of have the last word here.
I should not be honored with that. So no, I mean, Ryan's point about the right to housing, and that is a bill that's in the legislature right now. It's, I think, on its third year. And so please look that up. I think co-sponsored by Senator Anwar. And so that's an important piece. What I want to share about right to shelter, we're very close to a right to shelter place in New York. That's really their model. And so they're kind of the closest example. And I think there's some real positives around right to shelter, particularly that immediate crisis response. And so, and by no ways a subject matter expert here, but I really see it as the short game. We have a housing deficit. We have a housing crisis. We do not want to spend our time and resources in organizing ourselves to increase shelter, like to get people into shelter faster, right, to get people out of shelter faster. And we want permanent housing solutions in our communities. So, it is certainly an important intervention. New York has been a right to shelter state for, I think, like 2 decades or something to that effect. They have tens of thousands of people in shelter, and their length of shelter times are over a year. And that's because that, it handled one point of the process. So I just wanted to share that.
Thank you. And thank everyone for coming today. I know those of you that are town staff members and community volunteers, you are doing great work. And I hope that you feel more comfortable reaching out to our agencies statewide that are doing this work. Thank you to Amber, to Ryan, to Jennifer. This has been a fabulous learning opportunity, and I hope that many towns will be resourcing this coffee hour tape as they go through the actions. And so I just want to thank you all for being here today. Our website, sustainableCT.org, category 12 is where you'll find our housing actions. And when you scroll through any of those actions at the bottom, you will find resource links. The chat is here, and there are links that were put into the chat by some of our partner agencies. So this coffee hour will be posted, and you will be able to view it and to use it as a resource. And as always, any questions or comments, or if you need to get in touch with us, it's just info@sustainablect.org. Thank you very much, and have a wonderful Friday, everyone.
Thank you.